Welcome to the deep dive. Today, we'll be taking a close look at the latest research on curcumin for eye health. And this deep dive is aimed at ophthalmologists and healthcare professionals. You can consider this your shortcut to staying ahead. For the general public who are interested in learning more about eye diseases, I would recommend checking out Professor Dr. Suhail Sarwar's dedicated podcast playlist. Our source material today is a fascinating synopsis of findings from international journals compiled by the eminent eye surgeon, Professor Dr. Suhail Sarwar himself.
It's really cutting-edge stuff. You know, curcumin, that natural compound found in turmeric, is showing some very promising results in treating a variety of eye conditions, especially dry eye disease.
DED, right. It's something we encounter daily in our practice, and honestly, current treatment options can feel a bit limited.
Absolutely. Professor Sarwar highlights a recent study in Frontiers in Ophthalmology by Borselli and his team, which explores the impact of adding oral curcumin supplements to our standard hyaluronic acid-based tear substitutes for DED treatment.
Okay, let's unpack this. What did they do exactly?
They were very specific in their methodology. They focused on patients with moderate to severe DED, using what's called the non-invasive tear breakup time, or NIKBUT. Basically, it measures how long it takes for your tear film to break up after you blink. An anti-KBUT under 10 seconds is considered abnormal. They also use the Ocular Surface Disease Index, or OSDI, a questionnaire that scores the severity of dry eye symptoms. Participants needed a score greater than 12 to be included in the study.
So they had a well-defined patient group. What did they do with them?
They divided the patients into two groups. Both groups received hyaluronic acid tear substitutes, which is our go-to treatment, but one group also received a daily tablet of a curcumin-phosphatidylcholine complex, marketed as Norflow.
Interesting. And what were the results after 90 days? Did adding curcumin make a difference?
A significant one. The group taking both the tear substitutes and the curcumin supplement showed a much bigger improvement in bulbar redness. That's the redness in the white part of the eye. And they reported fewer dry eye symptoms compared to the group just using the tear substitutes.
That's pretty compelling. How did they measure those improvements?
They used a few different methods. They measured the tear meniscus height, which gives us an indication of tear volume. They also looked at meibomian gland dropout, the loss of those tiny glands that produce the oily part of our tear film. And of course, they remeasured both NIKBT and OSDI scores. They even used the Genvis redness score, which helps us objectively measure redness rather than just relying on what we see with our eyes.
Sounds like a very thorough approach. But every study has its limitations, right?
Of course. The authors acknowledge that we need longer-term data to see if these benefits hold up beyond those initial 90 days. Wow. That's something we need to bear in mind when we're talking to our patients about curcumin.
And they used a specific curcumin product, Norflow. Does that mean we can expect the same results with any curcumin supplement out there?
That's a great question. Norflow is a specific formulation of curcumin bound to phosphatidylcholine, which is a type of fat molecule. This creates what's called a phytosome, designed for better absorption. This raises a really interesting point about the importance of not just looking at the compound itself, but also how it's delivered into the body.
That makes sense. Speaking of delivery, Professor Sarwar's synopsis also touches upon curcumin nanocarriers. What are those exactly?
Think of nanocarriers as tiny vehicles designed to deliver drugs more effectively. With curcumin, this is especially important because traditional curcumin formulations aren't very water-soluble. This means they don't dissolve well in water. And as a result, they have poor bioavailability.
Meaning our bodies can't absorb and utilize them very well.
Exactly. And that's where nanotechnology comes in. By encapsulating curcumin in these tiny nanocarriers, we can overcome these limitations and potentially enhance its delivery to target tissues within the eye.
So how are these nanocarriers being studied in eye conditions?
Professor Sarwar highlights some really interesting research, such as a study published in Scientific Reports by Davis and his team. They used topical curcumin nanocarriers to protect retinal ganglion cells, or RGCs, which are the nerve cells that transmit visual information from the eye to the brain. They were particularly interested in glaucoma, where damage to these RGCs is a key feature.
How are these nanocarriers actually made?
They use two specific ingredients called TPGS and pluronic F127. You can think of them as the building blocks of the nanocarriers. They're chosen because they enhance the solubility, stability, and transport of curcumin, essentially making it more readily available to the cells.
Did they get positive results with this approach?
They did. They found that these topical curcumin nanocarriers were much more effective at protecting RGCs from damage compared to both untreated controls and free curcumin. They specifically looked at damage induced by glutamate and hypoxia, two factors implicated in the development of glaucoma.
Okay, so that's promising for glaucoma. But I'm curious, are there any studies exploring these nanocarriers for dry eye?
There are. A recent study published this year in Helion by Hadapour Jerome and his team investigated a curcumin nanoemulsion specifically for dry eye. They were able to induce dry eye in mice using atropine, and then they treated them with this nanoemulsion.
Interesting. What did they find?
They observed some encouraging results, particularly improvements in tear production and corneal health in the mice. The really impressive part is they didn't just rely on observation. They used a variety of techniques like dynamic light scattering, or DLS, which measures the size of the nanoparticles. They also looked at Zeta potential, a measure of the stability of the nanoemulsion, as well as transmission electron microscopy, or TEM, which allowed them to visualize the shape and size of the nanocarriers. And finally, they used high-performance liquid chromatography, or HPLC, to precisely measure the concentration of the different curcuminoids in the nanoemulsion.
So we've got these two exciting areas, oral curcumin supplements and topical nanocarriers. Are there other ways to harness the power of curcumin?
Absolutely. There's a third player in all of this: curcumin metabolites. That's right. Our bodies don't just use curcumin in its original form. They break it down into different compounds called metabolites. And one of the most interesting is tetrahydrocurcumin, or THC.
THC. Doesn't that ring a bell with something else?
It does, but it's crucial to clarify that this THC is not the psychoactive compound found in cannabis. This is a different THC altogether.
Okay, good to know. So what makes this THC so special when it comes to eye health?
Well, Professor Sarwar cites a comprehensive review by Cao and his colleagues, published in the International Journal of Molecular Sciences, that suggests THC may be even more powerful than curcumin itself.
Really? In what way?
It seems to have even stronger antioxidant and anti-inflammatory properties than curcumin, and those are really important when it comes to protecting the delicate structures of the eye.
That sounds promising.
Yeah.
But how does this THC actually work in the eye? What does it do?
Researchers believe it works in a few key ways. It activates pathways like SART1 and NRF2, which are like the body's natural defense systems against damage. These pathways are involved in cellular protection and antioxidant defense, helping to keep our cells healthy and functioning properly. THC also appears to act as an anti-VEGF agent.
We've talked about VEGF before, haven't we? That's a key player in conditions like AMD, where abnormal blood vessels grow in the eye, leading to vision loss. So if THC can block VEGF, it could potentially help prevent or even treat AMD.
Precisely. And it's not just AMD. THC is showing potential in a range of eye conditions like diabetic retinopathy, cataracts, even glaucoma.
Okay, so THC seems to have a lot going for it. Let's dive a bit deeper into some specific conditions. We've talked a lot about dry eye already, and those earlier studies on both oral curcumin and the nanoemulsion were pretty encouraging. Anything on THC specifically for DED?
While there aren't any specific studies on THC for dry eye yet, we can extrapolate from what we know about its mechanisms. Its potent anti-inflammatory and antioxidant effects could definitely play a beneficial role in managing DED. Remember, inflammation and oxidative stress are key drivers of dry eye.
So it's plausible that THC could be effective, but we need more targeted research. What about glaucoma? We talked about the nanocarrier study, but does THC offer anything for glaucoma management?
It does. Remember how THC activates those protective pathways, RT1 and NRF2? Well, these pathways are also crucial for the survival of retinal ganglion cells, or RGCs. In glaucoma, the loss of RGCs leads to irreversible vision loss. So by boosting these pathways, THC could potentially protect those vulnerable RGCs from damage.
That makes sense. And the anti-inflammatory effect could also be beneficial in glaucoma, right? Because inflammation plays a role there as well.
Absolutely. It's like a multi-pronged attack on the disease process.
What about AMD? We touched on THC's anti-VEGF potential earlier, but are there any studies specifically looking at THC and AMD?
While there aren't any human studies yet, preclinical research suggests that THC can indeed suppress VEGF expression. This means it could potentially help to prevent the growth of those abnormal blood vessels that are a hallmark of wet AMD. Plus, its antioxidant power could help protect the delicate retinal pigment epithelium, or RPE, which is often the first area affected in dry AMD.
So we're hitting the disease from two angles: potentially addressing both the wet and dry forms of AMD. But as with everything else we've discussed, we need to see those human studies to confirm these benefits.
Absolutely. We have to be cautious and not jump to conclusions.
Let's move on to diabetic retinopathy, or DR, another sight-threatening condition that affects many of our patients. Anything promising there with THC?
Definitely. Remember how THC inhibits VEGF? Well, that's incredibly important in DR because the overproduction of VEGF is a key driver of the abnormal blood vessel growth that we see in this condition.
So by blocking VEGF, THC could potentially prevent the progression of DR and help preserve vision.
That's the hope, and it doesn't stop there. Remember, THC also has anti-inflammatory and antioxidant properties, both of which are crucial in combating the damage caused by DR. And there's even research suggesting that THC might help inhibit platelet aggregation.
Hold on. What does platelet aggregation have to do with DR?
Platelets are those tiny blood cells that help with clotting. In DR, abnormal platelet aggregation can contribute to the blockage of those small blood vessels in the retina, further exacerbating the disease process. So if THC can inhibit this aggregation, it could potentially improve blood flow in the retina and help prevent further damage.
So THC could be a real game changer for DR.
Yeah.
But again, we need those human studies.
Absolutely. And it's not just THC that's showing promise in DR.
Okay.
Professor Sarwar's synopsis also highlights research on curcumin itself, showing potential benefits in managing the condition.
Really, how does that work?
Studies have shown that curcumin can help improve blood sugar control and reduce inflammation, both of which are crucial in preventing and managing DR.
So it seems like both curcumin and its metabolite, THC, have their own unique ways of addressing DR. That's fascinating. Before we move on, there's one more condition I want to touch on: cataracts. We know they're incredibly common, especially as we age, and surgery is currently the only effective treatment. Does curcumin research offer any hope for preventing or delaying cataracts?
It does. The Cow review highlights the role of oxidative stress in cataract formation. Think of oxidative stress as an imbalance in the eye, where harmful molecules called free radicals damage the lens proteins. This damage can lead to clouding of the lens, which is what we see in cataracts.
So where does curcumin fit into all of this?
Curcumin, with its powerful antioxidant properties, could potentially neutralize those harmful free radicals and protect the lens from damage.
That's really interesting. So we're essentially talking about using curcumin as a preventative measure to protect the lens from oxidative stress.
Exactly. And there's even research suggesting that curcumin could protect the lens from damage caused by UV radiation. We know that sun exposure is a risk factor for cataracts, so this is a particularly exciting avenue to explore.
So we're potentially looking at a natural, readily available compound that could help prevent one of the most common eye conditions in the world. That's huge.
It is, but we have to acknowledge that cataract surgery is already a very safe and effective procedure.
So the idea isn't necessarily to replace surgery.
Right. The goal is to explore ways to potentially delay the need for surgery, especially for people who might have limited access to healthcare.
That makes sense. It's about expanding our options and providing more comprehensive care. This has been an incredible deep dive. It seems like curcumin has so much potential in ophthalmology.
It really does. It's remarkable how this single compound, whether in its natural form or as a metabolite like THC, or delivered via these innovative nanocarriers, can target so many different pathways involved in eye disease. We've talked about inflammation, oxidative stress, angiogenesis, even cellular processes like autophagy and platelet aggregation.
It's almost like curcumin is this multi-tool for eye health, addressing so many issues at once.
It's a fantastic analogy, and the research is truly exciting. Think about it, a future where we can offer our patients safe, effective, and maybe even preventative treatments for some of the most challenging eye conditions, all using a natural compound like curcumin.
That's a future I'd love to see. But we have to be realistic and acknowledge that much of this research is still preliminary. We need more rigorous clinical trials to really confirm these findings, figure out the optimal dosages, treatment durations, and, of course, assess the long-term safety.
I completely agree. Translating these promising preclinical findings into real-world clinical practice is a crucial next step. We need to proceed with caution and carefully evaluate the evidence as it emerges.
So where do we go from here? What does this all mean for us as ophthalmologists and other eye care professionals?
Well, for me, it highlights the importance of staying informed about these emerging therapeutic avenues. We need to be aware of curcumin's potential, understand the ongoing research, and be prepared to critically evaluate the data as it becomes available.
This deep dive has certainly given me a lot to think about, and I hope it's done the same for our listeners.
It's been a pleasure discussing this with you. The potential of curcumin in ophthalmology is truly vast. And with continued research and collaboration, I'm optimistic that we're on the verge of a new era in eye care, one where natural compounds like curcumin play a key role in preserving and restoring vision.
On that hopeful note, we'll wrap up this deep dive into curcumin for eye health. Thank you for joining us, and be sure to keep exploring this fascinating area of research.